Looking around us, we have good reason to wonder whether we are a civilization in decline, in decay, in free fall, maybe even to some degree in collapse. And normally when we talk that way or we think that way, we're talking about the Biden administration, we're talking about terrible policies that have bad effects. But I want to address the question from a different side, which is just looking around in the culture, looking around at the lives of ordinary Americans and asking the question, how's it going? It turns out that there's new data that's just come out that is a clear indication that it is not going well. In fact, that the society, our society, has a kind of pervasive social, cultural, maybe even moral and spiritual sickness. We're suffering from a kind of national dementia a la Biden, or perhaps even the phrase is a national malaise. Remember that phrase? It was one that Jimmy Carter used in the late 1970s. Of course, the malaise then was a Jimmy Carter malaise, not a national malaise. But we might be having a national malaise now. Look at a very startling indication of this: life expectancy. So life expectancy, by and large, goes up and up and up. It's been going up in industrialized countries. It's in recent decades been going up in non-industrialized or so-called developing countries. Life expectancy in countries like India was in the 50s and then the early 60s, and now it's gone up to the 70s. Life expectancy in America has been in the high 70s, 78 or so. But now it's falling. What? It's going down. And for the second year in a row, life expectancy is 76 years. And now look, there was a short dip in life expectancy worldwide when COVID first came around. So in the first year or so, there was a worldwide drop in life expectancy, perhaps to be expected. But in 2021, there was a rebound, and countries essentially went back to their previous level, and now life expectancy is going up again. But in the United States, it has declined again a second year, and it's now at the lowest point in 2 decades. So the question is this part of a longer trend? And the answer is yes, it is. Why? Because actually our decline in life expectancy has nothing to do, at least not now, with COVID. It has to do, in fact, it has nothing to do by and large even with infectious disease. It has nothing to do with, for example, a collapse of the medical industry or the fact that somehow mysteriously more people are getting cancer. Not really any of that. It has to do really with the fact that death rates have jumped up, not just at the older level. Obviously, older people are closer to the end path of life. We're talking about death rates in young and middle-aged adults, aged 25 to 64. Sometimes these have been called so-called deaths of despair, but they are also deaths caused by things like diabetes, and heart disease, which are the result of, let's be honest about it, national obesity. We have become a ridiculously fat country. I can testify to this myself. When I walk into stores now, I pick up a shirt that is size large, but I look at it and it should be labeled size giant because it's so huge. Even the middle sizes are ridiculously large. There's also been a remarkable increase in death in children and teenagers, which has really, medical experts say, I haven't seen this in my whole career. Now, why are these death rates falling in the United States? The death rates have been falling for many decades because of advances in medicine. Also, by the way, doctors have become really good at curing birth defects, which would often cause people, they would live, but then their life expectancy would be shortened. So those cures have produced, these are factors increasing life expectancy. But interesting, even car accidents, deaths from car accidents have gone down. But the upward trend is caused by suicides, by homicides, and very importantly, drug overdoses, mainly in young people 10 to 19 years old. The fentanyl crisis has something to do with this. And the important point here is that these are man-made pathogens. These are preventable deaths. That's what makes it so pathetic and so tragic. So when Debbie says on the podcast there's a mental health crisis in the country, that is confirmed in these statistics. And these drug overdose deaths have been increasing. So this is not a problem in our healthcare system. People aren't going to the hospital. Oh, they don't have government-funded healthcare. No, it is basically that we are seeing an increase in drug overdoses, in homicide, and in suicide. Other countries now have higher life expectancy than the U.S. The U.S. was at the top along with other countries, and it's like we have dropped down a few notches. So other countries are now ahead of us. So we're living in a society now where a considerable portion of young people, remarkably, grow up in this country without the expectation of reaching full adulthood and full maturity. I mean, this is just a unnecessary tragedy, but I think it's a reflection. Sure, it has something to do with bad policies, but I think it also has to do with a destructive and dysfunctional culture, the breakdown of the family, the emergence of harmful peer groups, including, of course, gangs. And all of this is having its effects. At one time, some of these pathologies were largely identified in the Black or in minority communities, but now they are quite clearly nationwide crises. So we are, in at least to some degree, a spiritual malaise. And it may be that one of the recipes for it, there are a number of policy recipes, a number of sensible things that can be done, but a religious revival on top of those things certainly wouldn't hurt.